time for Med in a Minute, where I help you learn the most important information about a medication class in 60 seconds or less. Let's go. Calcium channel blockers include verapamil, nifedipine, and diltiazem. And our cool chicken hint to help you remember these three medications is to remember calcium channel blockers are very nice drugs. Indications for this drug class include hypertension, angina, and arrhythmias. They work by blocking calcium channels in the heart and blood vessels, which results in decreased heart rate and blood pressure. Key side effects include peripheral edema and hypotension, which are bold and red on this card because you are likely to get tested on that in nursing school. Other side effects include bradycardia and constipation. You'll want to monitor your patient's blood pressure and heart rate during therapy, and you'll need to remind your patient to avoid grapefruit juice and change positions slowly due to the risk for orthostatic hypotension.